The following portion of Studio 512 is sponsored by Renaissance Women's Group. Black Maternal Health Week is April 11th through the 17th. Doctors Alice Tong and Victoria Wheeler with Renaissance Women's Group are here to discuss the importance of medical education and awareness for this week. Y'all, good to see you both. And Dr. Wheeler, we're going to start with you. Tell us about this week, its importance, and why we should observe it.
Yeah, so maternal mortality in the U.S. is a great indicator of the health and the wealth of a nation. It shows how much the nation invests in families, women, and children. Learning that Black maternal mortality is about 3 times the rate as white women in the U.S. is appalling. Learning that the overall maternal mortality in the U.S. is greater than other nations at our same level is also appalling. So it's important to recognize this week, to bring light to it so we can discuss it more and come up with ways to remedy this.
Absolutely, and unfortunately, I don't think those numbers have been working in our favor the last couple of years. In fact, they've been getting a little bit worse. So it's important to discuss who we're talking about. Of course, we're talking about Black women, but Dr. Tong, that's not the only group we're discussing here.
Absolutely. Other women are also included, including Hispanic women, Asian and Pacific Islanders, and also other natives as well.
Okay, so basically anyone who is a non-Hispanic white woman falls into this kind of category that we are concerned about and that we need to raise awareness for this week. All right, so Dr. Wheeler, what would you recommend for women in this population to maintain a healthy lifestyle?
I do recommend for all women, it's important to stay up to date with your health, with your annuals. Preventative care is important in promising a healthy pregnancy and postpartum.
Absolutely, and you said to me personally, you should know your doctor, right? And they should know you.
And you should feel comfortable asking your doctor questions. You should feel supported by your doctor. If you don't, shop around.
Get somebody who understands where you're coming from. Okay, and Dr. Tong, not to bring the mood down just a little bit, but as we've discussed, this population of women is 2 to 4 times more likely to die of pregnancy-related causes than non-Hispanic white women. So what is your approach to caring for this group?
I mean, it is our job as clinicians to kind of look at the full picture, and so it's important for us to be aware of the risks, but also to convey those risks to our patients. Hopefully not in a way that is fear-inducing, but also we want, everyone to be aware and on the same page, and I think that ultimately that helps women take care of themselves as well as just to be, aware of everything that they even need to pay attention to.
Where I grew up, taking care of the matriarch of the family was important for the whole community. That's just something I've stuck to throughout.
Oh, wonderful. Y'all, thank you so much for your time and expertise this morning. We appreciate it.
Thanks for having us. Appreciate it.
Learn more about all the services provided by going to renaissancewomen's.com. The preceding portion of Studio 512 was sponsored by Renaissance Women's Group.